Here we'll learn about hemostasis, the body's mechanism to stop bleeding. Hemo meaning bleeding and stasis meaning to stop. First, start at table to note that hemostasis involves four key events: vascular spasm, which vessel damage induces vasoconstriction, which slows blood flow; platelet plug formation, adhesion, activation, and aggregation of platelets; coagulation, the conversion of liquid blood into a clot that comprises platelets, fibrin mesh, and trapped blood cells; and fibrinolysis, in which plasmin dissolves the clot. Let's show these steps starting with the formation of a platelet plug. Show a layer of ruptured endothelium, the subendothelium with exposed collagen fibers, and the vessel lumen. Write that the platelet plug is formed via adhesion, activation, and aggregation. Draw a disc-shaped inactive platelet and show that it contains granules. Now show that adhesion occurs mainly via bridging by von Willebrand factor. Next, show that adhesion to the subendothelium induces platelet activation. Platelets transform from disc-shaped structures to spiky structures with filopodia. This morphological change increases platelet surface area. Upon activation, platelet proteins, including thrombin, ADP, and thromboxane A2, will promote additional platelet recruitment and activation. As we'll see, thrombin also plays a key role in coagulation. In the next step, aggregation, show that ADP upregulates receptors that bind with fibrinogen, creating bridges between adjacent platelets. As a pharmacological correlation, write that aspirin limits platelet production of thromboxane A2, thus limiting platelet recruitment and formation via platelet plugs. After the plugs formed, and if vascular injury warrants clot formation, the coagulation cascade begins within seconds to minutes. Next, we'll show that the coagulation cascade comprises a series of amplifying enzymatic reactions that result in the deposition of an insoluble fibrin clot. The production of thrombin, which converts fibrinogen to fibrin, is integral to this process. List three key components of the coagulation cascade: calcium ions, which are required for several key reaction steps; coagulation factors, which are the driving forces of the cascade. They comprise pro-enzyme factors that are transformed to active enzymes and are signified by the lowercase a. Cofactors are reaction accelerators. They form complexes with activated coagulation factors and calcium ions. Now, redraw the ruptured endothelium, exposed subendothelium, and vessel lumen. The coagulation pathway comprises intrinsic and extrinsic pathways that converge to produce a clot. Intrinsic means that all elements involved are intrinsic to the blood. Extrinsic means that some elements involved arise from other tissues. In this tutorial, we'll show the coagulation cascade from the point where the pathways converge with factor X. See the links in our notes for more details. Show that activated factor X combines with calcium and cofactor 5A to form prothrombinase, which is the complex that transforms prothrombin, also known as factor 2, to thrombin, factor 2A. Now show that thrombin converts fibrinogen to fibrin, which forms a meshwork that surrounds the aggregated platelets and traps other materials, including red and white blood cells and serum. Be aware that thrombin plays additional roles in promoting clot formation and stability. These roles can be found in our advanced tutorial. Finally, indicate that clot retraction further strengthens the clot. This occurs when platelets trapped in the clot contract, pulling the edges of the damaged vessel together and creating a tighter seal. Once the vessel wall heals, the clot must be removed via fibrinolysis, the breakdown of the fibrin mesh. Indicate that the endothelial cells release tissue plasminogen activator, TPA, which promotes the formation of active plasmin, which in turn breaks down fibrin and other materials to dissolve the clot. Up until 2023, TPA was the primary clot buster, but tenecteplase now plays an important role as well. Before we conclude, return to our table and denote that atherosclerosis occurs when cholesterol is deposited in the arterial walls. These plaques alter the smooth endothelial lining of vessels and encourage the adhesion of platelets, thus initiating the clotting cascade. As a result, the risk for heart attack or stroke increases with increasing atherosclerosis. As another pharmacological correlation, to note that vitamin K antagonists are prescribed to inhibit clot formation in patients at risk of thrombosis. Warfarin is a key vitamin K antagonist. Up until direct oral anticoagulants were developed, warfarin was the mainstay for anticoagulation for many decades. This concludes our diagram.